We all want the same thing in the end. You know, we may not agree how to get there all the time, but in the end, we all want the same thing for GMH.
After weeks of heated debate on Bill 19 and gambling on Guam, Guam Memorial Hospital Administrator Joseph Verga says in the end, all will benefit from its passage into law earlier this week, as it provides revenues for the construction of an urgent care facility and some for operations.
It's really going to benefit the people of the island in many, many ways. And 40% of that of those funds are going to be devoted to or be directed to operations and or debt. So we're still quantifying how much that will mean. We don't really know exactly the impact. It's somewhere in the neighborhood of 2.2 million. And so if you took 60% of that, around 1.3 will be allocated to urgent care and around 900,000 thereabouts to operations.
Moving forward with implementing the new law, Verga must establish an urgent care planning committee within 30 days. 90 days after, the committee, to be comprised of members of the hospital and the community, must present their plan to members of the Guam legislature and the governor.
The urgent care center is what will be here, based here at the hospital, and will be close, especially with the new ER now almost scheduled to be completed. There is a section of the new ER allocated for urgent care. So it will be really a great operation. So someone that comes to the emergency room will see the triage nurse. The nurse will assess whether or not, what's wrong with you and whether or not you're truly urgent. Okay, you're emergency, you go that way. You're not an emergency, you go this way type thing.
The end result, reduced waiting time and reduced delays in care.
We're very excited that we have the means now to proceed to put this together. It's always been a part of my plan for GMH and a part of the strategic plan going forward.
The good news doesn't stop there. Verga reports GMH recently received an increase in daily rates from the Center for Medicare and Medicaid Services.
It's only $100 a day. It's not the increase, it will not cover our cost, and not the increase that we're looking for and we're still applying to receive. However, they recognized both the improvements being done here at the hospital. They recognize the accuracy of our cost reports now and the accuracy of the information that they're getting from GMH, much more so than they've ever received before.
The 6% increase means the hospital will now receive $1,100 per patient per day for those with Medicare. Although it's not the $1,600 needed, Verga is optimistic as GMH continues to submit information to CMS to justify an increase. Reporting for Guam's News Network, I'm Crystal Paco.